Screening for insurance. Have new patients arrive 15 minutes early to complete paperwork. Review materials for completeness and legibility. Make sure patients understand what is expected from them. Photocopy patient's driver's license and health insurance card. Questions to ask a patient for verification of insurance coverage. When they're calling in, you can verify this information: what type of insurance plan they have, their name, address, and phone number. You want to make sure that the plan that they have covers the procedure that the doctor may be ordering, and if the office visit requires a referral. Referrals and authorizations. PCPs refer patients to specialists. When doing so, there are 3 referral types. A regular referral takes 3 to 10 days to approve. There are urgent referrals, which take 24 hours to approve, and then a stat referral, which is a telephone approval. Pre-authorizations determines medical necessity for hospitalizations, surgery, and most elective procedures. This could be for such things as a CAT scan or MRI. The insurance company will sometimes require a pre-authorization if you're sending a patient, let's say, for an MRI. They want to know, well, what did you do prior to this to come up with the conclusion that the patient needs to go for an MRI? Was x-rays done? Was a CAT scan done? What other things were done that you need to refer a patient to have a more expensive procedure before they will approve it? Some questions for pre-authorization when calling Medicare for pre-authorization. Make sure you have the name of the insurance plan, address and telephone number, name and number of contact, copayment and deductible information, pre-authorization requirements, and participating hospitals and other facilities. Determining fee schedules. Common elements are used to determine a fee schedule. The overhead or practice expenses, this would be rent, equipment, utilities, etc. The cost of medical malpractice insurance. The hourly rate for services. This is determined by the skill and training required for the procedure. The more extensive a procedure, the higher the rate of service would cost. All schedules must follow UCR, usual, customary, reasonable. This fee schedule is a fee system that defines allowable charges that will be accepted by an insurance carrier. Usual fees are provider's average fee for a service. Customary fee is the average fee within a geographic area that an insurance carrier will accept. Reasonable is a general accepted fee that relates to the type of service rendered. Again, this is based on the procedures that are more complicated or require more time or more skill by a doctor. Legal and ethical issues. We always want to treat every patient equally, whether insured or not. And always make sure that your confidentiality of your medical records and you keep your HIPAA implications in check. Insurance fraud and abuse. Fraud is the intentional deception, coding at a higher level of service, altering diagnosis to justify payment, billing for services not performed, receiving compensation for referrals. Abuse is inconsistent activities of usually accepted business practice, overcharging, improper billing, violating agreement with insurance company. Both of these can cause the physician's office to be taken out of the insurance plan with the company, so you have to be very careful. In summary, the increasing complexity of health insurance today means that MA must continually update their information on the subject. Understanding the role of insurance, terminology, and various forms gives the medical assistant the confidence to take on the responsibility of filing a claim properly.